Good evening, sir. I am Shara Laguros, and I'm going to present Study Guide 1, which is the Introduction to Abnormal Psychology and Historical Review. So first and foremost, what is abnormal psychology? So, abnormal psychology is the scientific study of abnormal behavior with the intent to be able to predict reliably, explain, diagnose, identify the causes of, and treat maladaptive behavior. Abnormal behavior can become pathological and has led to the scientific study of psychological disorders or psychopathology. The study of psychopathology is a search for the reasons why people behave, think, and feel in unexpected, sometimes odd, and possibly self-defeating ways. So, in simple words, psychopathology is the study of nature, symptomatology, development, and treatment of psychological disorders. So, there are challenges in the study of psychopathology. First is maintaining objectivity. So, it's really hard to maintain objectivity in this field. Second, avoiding preconceived notions. And the third is reducing stigma. So, stigma, we'll discuss that later. So, the key characteristics in the definition of mental disorders or 4Ds are personal distress, disability, deviance or violation of social norms, and dysfunction. So, psychological dysfunction. It is a breakdown in cognitive, emotional, or behavioral functioning, but considered to be in a continuum or a dimension rather than to be categories that are either present or absent. Dysfunction. Abnormal behavior, therefore, has the capacity to make well-being difficult to obtain and can be assessed by looking at an individual's current performance and comparing it to what is expected in general or how the person performed in the past. Personal distress. A person's behavior may be classified as disordered if it causes him or her great distress. Distress happens when the person experiences a disabling condition in social, occupational, or other important activities. It can take the form of psychological or physical pain, or both concurrently. Disability. It is an impairment in some areas of life, for example, work or personal relationship. It can also characterize mental disorder. Impairment is set in the context of a person's background. Deviance or violation of social norms. Reaction is outside social norms. Something is considered abnormal behavior because it occurs infrequently. It deviates from the average. Social norms changes over time due to shifts in accepted values and expectations. Thus, a person is said to be deviant when he or she fails to follow the stated and unstated roles of the society. Classifying mental disorders. Classification provides us with a nomenclature or naming system to structure our understanding of mental disorders in a meaningful way. Of course, we want to learn as much as we can about a given disorder so we can understand its cause, predict its future occurrence, and develop ways to treat it. Epidemiology is the scientific study of the frequency and causes of diseases and other health-related states in specific populations, such as school, neighborhood, a city, country, or the world. Psychiatric or mental health epidemiology refers to the occurrence of mental disorders in a population. In mental health facilities, we say that a patient presents with a specific problem or the presenting problem, and we give a clinical description of it, which includes information about the thoughts, feelings, and behaviors that constitute that mental disorder. We also seek to gain information about the occurrence of the disorder, its cause, course, and treatment possibilities. Occurrence can be investigated in several ways. First is the prevalence. Prevalence is the percentage of people in a population that has a mental disorder, or can be viewed as the number of cases divided by the total number of people in the sample. Incidence. Incidence indicates the number of new cases in a population over a specific period. This measure is usually lower since it does not include existing cases as prevalence does. Comorbidity describes when two or more mental disorders are occurring at the same time and in the same person. Etiology is the cause of a disorder. There may be social, biological, or psychological explanations for the disorder which need to be understood to identify the appropriate treatment. If etiology is the cause of the disorder, course is its particular pattern and can be acute, chronic, or time-limited. A disorder may be acute, meaning that it lasts a short time, or chronic, meaning it persists for a long time, or time-limited, meaning that recovery will occur after some time, regardless of whether any treatment occurs. Prognosis is the anticipated course the mental disorder will take. A key factor in determining the course is age, with some disorders presenting differently in childhood than adulthood. Treatment is any procedure intended to modify abnormal behavior into normal behavior. The person suffering from the mental disorder seeks the assistance of a trained professional to provide some degree of relief over a series of therapy sessions. The trained mental health professional may prescribe medication or utilize psychotherapy to bring about this change. What is a stigma? So, a stigma refers to the destructive beliefs and attitudes held by a society that are ascribed to groups considered different in some manner, such as people with mental illness. The four characteristics of stigma are: distinguishing label is applied, label refers to undesirable attributes, people with a label are seen as different, and people with a label are discriminated against. Stereotypes about people with a mental disorder can quickly and easily transform into prejudice when people in a society determine the schema to be correct and form negative emotions and evaluations of this group. Overlapping with prejudice and discrimination in terms of how people with mental disorders are treated is stigma, or when negative stereotyping, labeling, rejection, and loss of status occur. The Diagnostic and Statistical Manual, or DSM. It is the widely accepted system. It is used to classify psychological problems and disorders, and it contains diagnostic criteria for behaviors that fit a pattern, cause dysfunction and subjective distress, are present for a specified duration, and for behaviors that are not otherwise explainable. DSM-5 describes behavioral, psychological, and biological dysfunctions that are unexpected in their cultural context, associated with present distress and impairment in functioning, or increased risk of suffering, death, pain, or impairment. The history of psychopathology. Demonology. It is a doctrine that an evil being or spirit can dwell within a person and control his or her mind and body thereby can be treated by exorcism, the ritualistic casting out of evil spirits. Cutting holes to the skull in belief that evil spirits may come out is called trephination, while patients who are shocked back to their senses by being submerged in ice or cold water is called hydrotherapy. Early biological explanations. So Hippocrates believed that mental disturbances have natural causes. There are three categories, namely mania, melancholia, and phrenitis. There are also four humors, and these are blood, black bile, yellow bile, and phlegm. During the Dark Ages, the church gained influence and the papacy was declared independent of the state. Christian monasteries, through their missionary and educational work, replaced physicians as healers and as authorities on mental disorder. Monks cared and prayed for mentally ill and concocted potions. The persecution of witches. Witchcraft was viewed as instigated by Satan, was seen as a heresy and a denial of God. Those accused of witchcraft was tortured, and historians concluded that many of the accused were mentally ill. Lunacy trials began in 13th century in England. So in lunacy trial, municipal authorities assumed responsibility of care of mentally ill. Trials were held to determine sanity. The trials were conducted under the Crown's right to protect the people with mental illness. So lunacy refers to the attributes insanity to misalignment of moon and stars. Mass hysteria is characterized by large-scale outbreaks of bizarre behavior. In Europe, whole groups of people were simultaneously compelled to run out in the streets, dance, shout, rave, and jump around in patterns as if they were at a particularly wild party late at night, but without music. The behavior was known by several names, including St. Vitus dance and tarantism. Asylum. Asylums are establishments for the confinement and care of mentally ill. So, Priory of St. Mary of Bethlehem is one of the first mental institutions and located in London, which has now eventually became one of London's great tourist attractions. Pinel's reforms and moral treatment. Philip Pinel pioneered humanitarian treatment. Pinel is said to have begun to treat the patients as sick human beings rather than as beasts. So for moral treatment, small, privately funded humanitarian mental hospitals. Patients engage in purposeful, calming activities such as gardening and patients talk with attendants. They're not treated like beasts anymore. Dorothea Dix is a crusader for prisoner and mentally ill. Work established 32 new public hospitals. Hospitals staffed with physicians, known as mental hygiene movement. Early foundations for psychological approaches. Mesmer treated patients with hysteria using animal magnetism. Early practitioner of hypnosis called mesmerism. Then Joseph Brewer used hypnosis to facilitate catharsis. So catharsis is the release of emotional tension triggered by reliving and talking about the event. Freud's psychoanalytic theory. So human behavior is determined by unconscious forces. Psychopathology results from conflicts among these unconscious forces. So Freud's structures of the mind are id, ego, and superego, where id is the unconscious, pleasure principle, immediate gratification, and libido. Ego is the primarily conscious, reality principle, and attempt to satisfy its demands within reality's constraints, while superego is a conscience, develops as we incorporate parental and societal values. Neo-Freudians. So the Neo-Freudians are Jung and Adler. So for Jung, he used analytic psychology and incorporated Freudian and humanistic psychology. He also stated that there is collective unconscious for Jung, and he made the archetypes. For Adler, individual psychology, fulfillment derived from working for the social good. So, continuing influences of Freud and his followers. First, childhood experiences help shape adult personality. Second, there are unconscious influences on behavior. And third, the causes and purposes of human behavior are not always obvious. The Rise of Behaviorism by John Watson. John Watson is the author of Behaviorism. Behaviorism, the emphasis on learning rather than innate tendencies, focuses on observable behavior and classical conditioning. Ivan Pavlov is learning through association. There are elements of learning: unconditioned stimulus, unconditioned response, and conditioned response. Watson and Raynor. Classical conditioned fear in Little Albert. So their fear was developed. Operant conditioning by E. Thorndike and B. F. Skinner. So for Thorndike, learning through consequences, law of effect. And for Skinner, principle of reinforcement. So for positive reinforcement, behaviors followed by a pleasant stimuli are strengthened, and for negative reinforcement, behaviors that terminate a negative stimulus are strengthened. Modeling. Learning by imitating others' behavior can occur without reinforcement. And by Bandura and Menlove. Modeling reduced children's fear of dogs. Behavior therapy. Systematic desensitization and aversive conditioning. For cognitive therapy and rational emotive therapy, based on the idea that people not only behave, they also think and feel. They emphasize that how people construct themselves and the world is a major determinant of psychological disorder. Different mental health professionals include clinical psychologists, psychiatrists, social workers, counselors, and mental health therapists. Each involves different trainings and programs of different lengths and with different emphasis on research, psychological assessment, psychotherapy, and psychopharmacology. Thank you!